So you're looking at an ECG and you're wondering, is this normal? ECG interpretation can be tricky, and even experienced doctors sometimes miss subtle details. But don't worry, today I'll break it down into 10 simple rules that will help you analyze any ECG with confidence. By the end of this video, you'll know exactly what to look for. Let's get started. The ECG is one of the most powerful tools in medicine, but here's the issue. Misreading it can lead to life-threatening mistakes. That's why today, we're going over the 10 key rules of a normal ECG. Follow these, and you'll never second-guess yourself again.
Rule number 1. Heart rate.
60 to 100 beats per minute. The first thing you check, heart rate. A normal resting heart rate is between 60 and 100 beats per minute. Too slow? That's bradycardia. Too fast? That's tachycardia, unless the patient is stressed, in pain, or exercising. Quick tip. If you're in a rush, count the number of big squares between two R waves. 5 big squares equals 60 beats per minute. 3 big squares equals 100 beats per minute. If you want to be precise, use the 300 rule. Divide 300 by the number of large squares between R waves. But here's a mistake people make. Don't rely on the machine's reading alone. Always double-check manually.
Rule number 2. Rhythm.
Regular or sinus rhythm. A normal ECG should have a regular rhythm. This means the RR intervals are consistent. Look at multiple leads to confirm. But what if it's irregular? If it's completely random, think atrial fibrillation. If it's regularly irregular, it could be a second-degree heart block or ventricular bigamy. A quick trick? Use calipers or paper to check the distance between R waves. If it's off, investigate further.
Rule number 3. P wave.
Before every QRS complex. Every normal heartbeat starts with a P wave.
It should be upright in lid 2, lid 3, and lid of VF. And 1 P wave before every QRS complex.
If P waves are missing or inconsistent, suspect. Atrial fibrillation, no clear P waves. Heart block, extra or missing P waves. Ectopic atrial rhythms, abnormal P shape. Quick case. A 65-year-old patient comes in dizzy, and you see P waves with no QRS after them. That's a classic third-degree heart block. Time for a pacemaker.
Rule number 4. PR interval.
120 to 200 milliseconds or 3 to 5 small squares. The PR interval tells us how well electrical signals move from the atria to the ventricles. It should be 3 to 5 small squares long. Too short? Wolff-Parkinson-White syndrome, WPW. Too long? First-degree heart block. Want to be precise? Use the caliper method to measure the interval. Don't eyeball it.
Rule number 5. QRS complex.
Narrow, less than 120 milliseconds. The QRS complex should be narrow, less than 120 milliseconds, or 3 small squares. A wide QRS? That suggests bundle branch block, ventricular tachycardia, hyperkalemia. Common mistake. If the QRS is wide, don't ignore it. Always check for a bundle branch block pattern or old infarcts.
Rule number 6. ST segment.
Flat or isoelectric. The ST segment should be flat. If it's not, you need to act fast. ST elevation equals heart attack. STEMI.
ST elevation myocardial infarction.
ST depression equals ischemia or electrolyte imbalance. A real case, a 45-year-old man with chest pain, shows ST elevation in leads 2, 3, and AVF. That's an inferior MI. Call cardiology immediately.
Rule number 7. T wave.
Upright in most leads.
Check the T wave. They should be upright in lid 1, lid 2, lid V3, lid V4, lid V5, and lid V6.
Tall, peaked T waves.
It's hyperkalemia.
Inverted T waves.
It's either ischemia or hypertrophy.
A quick test. If the T wave is taller than half the QRS height, suspect electrolyte imbalances.
Rule number 8. QT interval.
Corrected QTC less than 440 milliseconds in men, less than 460 milliseconds in women. The QT interval is critical because a prolonged QT can lead to a deadly arrhythmia called torsades de pointes. A normal QTC is 440 milliseconds in men, 460 milliseconds in women. Long QT, check for medications, low calcium, or congenital long QT syndrome.
Rule number 9. Axis.
Between -30 degrees and +90 degrees. The heart's electrical axis should be between -30 degrees and +90 degrees. Leftward deviation could be left ventricular hypertrophy or heart disease. Rightward deviation, think pulmonary hypertension or right heart strain. Quick trick,
Look at lid 1 and lid of EF.
both positive, normal axis.
Lid 1 negative, and lid of EF positive.
Right axis deviation,
Lid 1 positive, and lid of EF negative.
left axis deviation.
Rule number 10.
No abnormal extras. No blocks, ectopics, or arrhythmias. A normal ECG shouldn't have extra beats, pauses, or conduction issues. Common abnormalities: heart blocks, PR interval problems, ectopic beats, early or irregular beats, atrial fibrillation, chaotic rhythm, no P waves. Scan each lead for unexpected findings. If something looks odd, investigate further.
Let's summarize. 1. Heart rate should be between 60 to 100 beats per minute. 2. Rhythm must be regular, also called sinus rhythm. 3. P waves should be present before every QRS complex, and upright in lead 1, lead 2, and lead AVF. 4. PR interval must be between 120 to 200 millisecond, or 3 to 5 small squares. 5. QRS complex should be narrow, less than 120 milliseconds, with no pathological Q waves. 6. ST segment should be flat or isoelectric, without elevation or depression. 7. T waves should be upright in lead 1, lead 2, and lead V3 to lead V6. 8. QT interval, or QTC, must be less than 440 milliseconds in men, and less than 460 milliseconds in women. 9. Axis should be normal, between -30 degree to +90 degree. 10. No abnormal extras like arrhythmias, blocks, or ectopic beats should be present.
And that's it. The 10 rules of a normal ECG. Follow these, and you'll never miss a critical finding.